The Nigeria Center for Disease Control, NCDC, has announced that 75 health workers across the country have tested positive for COVID-19 during the past 1 week. This was disclosed by the Director General Chikwe Ihekweazu at the national briefing of the Presidential Task Force on COVID-19 on Monday in Abuja. Ihekweazu, during his address, urged Nigerians to be vigilant and extra careful to minimize the spread of the infection. TV360's correspondent Abisola Adebayo has the details in his next report.
In the fight against the coronavirus pandemic, all frontline health workers must be protected at all costs. This is the submission of the federal government as over 75 health workers tested positive for the COVID-19 in the past 1 week. In this regard, the Nigeria Center for Disease Control, NCDC, is set to launch the rapid diagnostic test kits in more health facilities over the next 1 month to protect healthcare workers across the country.
In the last 1 week, we had 75 healthcare workers infected in Nigeria. So we're very worried about this. We can reduce this risk. We're hoping that by rolling out the use of RDTs, more health facilities will have access to this over the next month, and this will really become a major tool in protecting ourselves, understanding the infection among ourselves, and understanding what we'll need to do.
On the effort of the federal government to acquire doses of the COVID-19 vaccines, Minister of Health has expressed concern over the scramble for the limited quantities of vaccines around the world. The health minister called for global equity in the distribution of the COVID-19 vaccine to ensure full eradication of the pandemic.
A spokesman of the World Health Organization over the weekend estimated that 95% of all vaccines manufactured globally so far have gone to 10 wealthy, powerful countries. We join the WHO in calling for global equity in the allocation of vaccines, since COVID-19 is a threat to mankind and not just to one country alone. Besides, the Director General of the World Health Organization has repeatedly stated that no country is safe until all countries are safe.
In a bid to manage the spread of the infection, the Presidential Task Force declared Kogi State a high-risk state for refusing to acknowledge the existence of the disease.
States that are not testing are probably much more higher risk than the states that currently we know as high-burden states. A state that is not testing at all is an absolute high risk for Nigerians to go there, because there is no testing facility even if you fall sick, and there is no isolation facility, and they don't even acknowledge that the disease exists. So for that reason, epidemiologically, we put that state at the top of high-risk states.
Earlier, the Inspector General of Police Mohammed Adamu ordered full enforcement of the COVID-19 health protection regulations, which was signed into law by President Muhammadu Buhari on January 26, 2021, asking senior officers to ensure full compliance in their respective areas of responsibilities. Abisola Adebayo, TV360, Lagos.